What it do, Dream Team? It's your boy D Neal back with another reaction video, guys. Here we are with Bernie Sanders on billionaires, healthcare, and how to get rid of Trumpism, part 2. Before we dive in, make sure you subscribe to the channel, ring notification bell, get a video a thumbs up so it gets suggested. You guys got a favorite video suggestion, you can subscribe to Patreon and drop it in the comment section. Oh my God, Bernie!
That's exactly right. Look, if I make a major contribution to you,
to me. Yeah.
to you personally,
Okay.
if you want to run for the senator someplace in New York, and I help raise $50 million for you, you're indebted to me, right? You're
Yes.
going to listen to me.
Exactly.
In terms of lobbyists, do you all know what lobbyists are? Yes. All right. Again, the terms in the United States may be a little bit different than here. Lobbyists are people who represent corporate interests trying to get their ideas and their needs through. Give you one example. There are 100 members of the U.S. Senate. There are 435 members of the House of Representatives, 535 members of Congress. There are 1,700 well-paid lobbyists from the pharmaceutical industry in Washington, D.C.
Wow.
My
Isn't that extraordinary?
God.
And the result of that, these guys have managed to create a situation where, unlike the UK, by the way, they can raise prices to any level they want. You go to a drugstore, buy your medicine, price is double than it was last year, no problem. They can do it.
That's
because
crazy.
of their power, their money, their lobbyists.
Well, let's
That's
talk about healthcare in
crazy.
the US, because the NHS in the UK is struggling at the moment. And it's because it's understaffed, it's underfunded.
Right.
It's kind of, we have nurses that are going to Australia where you can get a better wage, better working conditions and all these things. So I think we, as a nation, it feels like we're struggling with the NHS probably for the first time collectively. But we sometimes don't realize how lucky we are when we look at the insanity of the US medical system.
If your
It's
system
ridiculous.
is struggling, I think the answer is to fully fund it. But right now, we spend $13,000 for every man, woman, and child. Can you imagine? A family of four, $52,000 a year. Average salary is, $55,000. Astronomical sum of money. And yet, despite that huge expenditure, we have 85 million, that's about a third of our country, who are uninsured or underinsured. Now, I'll bet you that many in the audience here, because of your system, don't even know what the word underinsured is. What does that mean?
Yeah, exactly. I have no idea.
So when you hear about the American system, hear this. Most people get their insurance through their employer.
Yeah.
Some employers are very generous and they provide a very good benefit. Many do not.
sure.
The average benefit, more or less, would be something like this. All right, Russell, you work for me, you get your wages, and we're going to give you a health care benefit, but there will be a $10,000 deductible. That means you have to spend $10,000 out of your own pocket before insurance kicks in.
Crazy.
So if you got hit by a bus and it was a $100,000 bill, insurance would pay 90, but you got to pay the first 10. But if you're just sick, right? You say, oh, I'm pretty bad, I should go to the doctor. But you know what? I don't have the $200 that I need to go to the doctor. You don't go to the doctor. And the result of that is that over 60,000 Americans die every single year because they don't go to a doctor when they should.
Wow.
Then in addition...
That's fact. I know that has to be facts. Because I feel like I'm one of them who just... Because I feel like healthcare is a ridiculous amount of money per month. And I'm like, oh my Lord, like, my days. So I'm out here just playing, and I don't have health insurance, so I don't really get sick a lot. It's pretty rare that I get sick, but when I do, it's just like get some over the counter medicine, try to sleep it off. Know what I'm saying? That's because, like you said, $200 to go to a doctor visit, and a lot of the times the doctor just gonna prescribe you the same medicine that I could have got over the counter. They're going to check you out for 5 minutes, write a prescription for some extra strength Advil. I could have got that at the store for $10. And now I'm paying $200 something because I came to see. So, yeah. But a lot of people with more serious sicknesses or illnesses or lifelong illnesses, they can't afford a lot of these medicines.
Single year because they don't go to a doctor when they should.
Wow.
Then in addition to that, all right, so you got to figure out, you got to pay You know, the first, whatever it may be. Sometimes it's a $5,000 deductible, sometimes it's $15,000. Depends. We got hundreds of different insurance plans. All right. Then, in addition to that, most of the plans will say, you go to the doctor, you got a co-payment. What does that mean? If the bill is $200, maybe you pay 20, maybe you pay 30 out of your own pocket.
Yep.
So I have talked to many doctors in my own state of Vermont and all over the country who say people come into their office and they're really, really sick. And they say, well, why didn't you come in when you first had your symptom? Answer is, I didn't have any money. I couldn't afford to pay the bill.
Yeah.
In America today, some 500,000 people go bankrupt because of medically related bills.
Crazy.
In other words, you end up in the hospital, God forbid, with a serious illness. You come out with a $200,000 bill, you can't pay it. You go bankrupt. Your credit is shot because you can't pay off your medical bill. And by the way, top of all that, our life expectancy in the United States is lower, significantly lower than many other countries, despite all that we spend. So my thought is, and this is one I feel strongly about, I understand that the NHS is struggling now. Do not look to America
Oh yeah, I think
as an example of how you want to strengthen the system. And I want to say this also, while I'm here in the UK. Your country in 1948 did something that was revolutionary and important for all of humanity. What the Labour government said in 48, with Nye Bevan leading it, is that healthcare is a human right for all people, not just a privilege. That was a step forward for all of humanity.
Absolutely.
Fact. I like Bernie. I like our healthcare is a human right. Healthcare is not a privilege. There are people born with illnesses. They didn't do anything to be born with an illness. It should be a human right. Right? That they have the medication that they need to keep on living. Come on now.
Not just a privilege. That was a step forward for all of humanity.
Absolutely. You've spoken a lot about the Scandinavian approach to healthcare, for example. Right. And they have a similar approach. The hospitals are much better. The prisons are far better because they,
rates of recidivism.
Yeah, exactly. But again, it feels like, how do you get over the hump of the tax problem in the US, particularly because it feels like as soon as you talk about, repairing healthcare or Obamacare or Medicare or whatever it may be, straight away it becomes, oh, well, you're just woke. You're just a communist. You want my kids to all wear the same clothes. It's amazing how quickly it turns into that argument.
Well, one of the things, Russell, that I have noticed, and again, this has been an honor in my life.
Well, thanks. Same here.
In addition to being with you,
Yes, sir.
the other honor I've had in my life is going around the country. And, when you speak to ordinary people, and not just the people who own the media, they look at the world a little bit differently. So when you talk about taxes, you're right. But if you talk to many of the people in Scandinavia, for example, they say, yeah, we pay a lot in taxes, but you know what? We get a lot in return. Mm-hmm. Now, in America, we have, for example, a dysfunctional child care system.
Yeah.
You know how much it costs? $15,000 at least to send your kid to child care.
That's crazy.
So if you're a family making $50,000 or $60,000, that's pretty impossible.
Yeah, exactly.
Unlike the quality child care they have in many of the Scandinavian countries, Finland and elsewhere. Mm-hmm. Here's something that many people don't know. All right, you tell me, you have a baby here in the UK, what happens? How much time off do you have to nurture the baby?
Anybody?
You got 9 months paid leave?
Is that for both? No. Okay, because in Scandinavia it's a year for both, I know that.
All right. You know how much it is in the United States guaranteed? Anyone know? 0.
Really?
That's the response I was looking for. Yeah. Unbelievable. So the truth is, and I've talked to this, a low-income, working-class woman, maybe a single mom, gives birth, she's back at work in a week or two.
Crazy.
Because she needs the income to take care of her family.
But then how does she afford the $15,000 to look after?
Of course. She doesn't. She can't. I mean, that's the stress.
Exactly.
That is you. Thank you. I mean, that's exactly the issue. The difference between poor and rich in America, and I'm sure it's not different here, is not that I have a big house and you're poor, you have a small house. I have a good car, you have a broken down car. That's not the difference. The difference is you have got to worry every single day how you stay alive. How are you going to pay your rent? How are you going to eat? What happens if your car breaks down and you can't get to work? You know what that stress does to you? Day after day, it rips apart your body.
Absolutely.
And you die.
Yeah.
You die younger.
Rips apart your body. Now you're stressed because you can't afford the health care that you need. It's crazy. He's so spot on with it. He's so spot on. This is insane, right? To have to go back to work literally a week or two after. And I'm not saying some companies don't offer new mothers, right, the time off that they need. But it's not guaranteed as it is in other countries. So a lot of the companies don't offer the time that you need. And as you can't, they may offer the time, but it won't be paid. So you can't take too much time off work because you can't. Then you don't have the money to feed your child. But then you want to go to work and you can't afford to send your child to health care. So usually you end up taking them to a grandparent's house, taking them to aunts, uncles, whoever you can to watch them for free. And it becomes a burden on them. They're tired of watching. So it's crazy. Like he said, the difference is that the poor have to worry like every second of their lives about like how they're going to stay alive, or every day how they're going to stay alive. If a car breaks down, it's a major problem. If they can't get to because they can't get to work, now they can't get to work. They, you know what I'm saying? That's a big loss for them. So it's just a lot of worry. He's spot on.
Even if you have decent health care, you will die younger. So what the Scandinavians have done, and they'll be the first to tell you they're not perfect.
And let's not forget, when you talk about how a society can evolve, this is Scandinavia. They used to travel the world pillaging and raping, and now they recycle. That is, like, in terms of journeys. So we can change.
We can change. We can. You know, and just think, here's the point. You know, we try to make austerity economics means that if you don't really work hard and you have a certain amount of luck, you're really in deep shit. That's a technical term we use in the United States. And all that this book is about is saying that given everything that's happening in this world, the wealth, the technology, can we not take that stress in terms of survival off the backs of people? What does it mean if everybody has decent health care? Can we do that? Yeah, we can. What happens if we move toward a situation where workers have more control over the work that they do? Interestingly enough, there was just a study, I don't know if you saw it, that came out of the UK, I think it was last week. And what it said, a number of companies experimented with a 4-day work week.
Yeah.
And the results were really quite strong. Workers felt great about it. They became more productive. The quality of their lives improved. Their stress level went down. Companies felt good about it. Those companies are going to continue it. As technology develops, should we not be thinking about a 30, 32-hour work week for workers?
Come on now. Come on now. Bernie, you preaching. Bernie, you preaching.
But how do we do it? Like, my brain, I was racking my brains. Again, this is a first thought idea, but I don't know if you've ever seen Darren Brown, but the face says no, but he's sort of a trickster. He's like a hypnotherapist. Do we get Darren Brown in front of some of these guys? And no, okay. Just an idea. Look, but how do we? I guess I'm.
You know, what underlies everything that I believe is we share a common humanity, no matter where we live, what country we live in, what color our skin is, what our sexual orientation, whether we're men or women. I think there's a common understanding of what a good life is about. And we have got to bring our people together to stand up and say this world belongs to all of us and not just a few. And what worries me so much is the people on top. They're powerful not just in the United States. They got their pals in Saudi Arabia, and they got their friends in China. And you got this oligarchy all over the world with incredible wealth and incredible power. In Russia as well, of course. And our job is to organize, to have a vision of a society which works well for all. But it's not going to be a hypnotherapist that does it. It is going to be difficult. I mean, you know, in your country and my country, people have fought and died for human rights, whether it's women's rights, workers' rights, whatever it may be. And that's the struggle that we have got to undertake.
Nah, I really like this interview. I really enjoyed this interview. But that's all we got for part 2. You guys got a favorite video suggestion, you can subscribe to Patreon or drop it in the comment section. It's your boy Neal, out.